For all your medical questions, turn to the experts, East Cooper Medical Center.
The knee is composed of 3 separate compartments. If all 3 compartments of the knee involved, then a total knee arthroplasty is the only viable option. However, recent studies have shown that 10 to 25% of all people with osteoarthritis of the knee involve only 1 to 2 compartments. When a total knee arthroplasty is performed, all 3 compartments of the entire knee is replaced. The anterior and posterior cruciate ligaments are sacrificed, as well as any normal cartilage that's in the knee adjacent to damaged cartilage. In a partial knee replacement, the anterior and posterior cruciate ligaments are preserved, as well as any healthy articular cartilage. The only tissue that is removed is the damaged articular cartilage. This can lead to shorter hospital stays, quicker recovery time, less postoperative pain. Partial knee replacements have been technically difficult throughout the years because of implant placement as well as ligamentous balancing. It's much more difficult to perform than total knee arthroplasty. With the new technology called Makoplasty, we're able to precisely and reproducibly place an implant in a patient's knee. This is performed as a CT scan is performed of the patient's lower extremity. This information is fed into a computer which allows us to make a 3-dimensional model of the knee. On this 3-dimensional model, we can place the implant in various positions to find the ideal position for the implant that is specific for that patient. We can virtually perform the surgery as many times as necessary to find the ideal position for the implant. This will allow us to precisely place the implant and obtain ligamentous balancing. This information is fed into a Rio robot. The patient comes to the operating room, we make the incision, the robotic arm is brought in, it's surgeon controlled, and we can use a precise burr to remove only the damaged tissue in the knee. And then we can place the implant exactly where it was planned on the preoperative template and preoperative planning. With Makoplasty being a minimally invasive procedure with less tissue dissection, patients are able to go home usually the day after surgery and are back to recovery much quicker than a total knee replacement. The recovery time is probably half what it is in a total knee replacement. Some patients are within a week doing back to normal activities and doing things that they enjoy to do. So it's a very exciting technology and something I think that can really help people get back to activity.